When a dog stops eating food, most owners feel confused and worried, but many still do not understand how serious this problem can be. Dogs are creatures of habit. They eat at the same time, in the same place, with the same excitement. When this pattern breaks, it is never without a reason. A dog does not stop eating to annoy the owner. A dog stops eating because something inside the body or mind is not right. This is where most people make a mistake. They focus only on the food bowl, but the real problem is often much deeper. Loss of appetite is usually the first visible sign that something is changing inside the dog. Sometimes it is small and temporary, but sometimes it is the beginning of a chain of health and behavior problems. In many cases, eating problems are not alone. They slowly lead to silence, low energy, less barking, more sleeping, and emotional withdrawal. That is why understanding this first problem is very important. If you understand why your dog is not eating, you can also understand many other behaviors that will appear later. One of the most common reasons dogs stop eating is stress. Stress in dogs is very different from stress in humans. Dogs cannot talk, complain, or explain what they are feeling. They express stress through behavior changes. Even small changes that humans think are normal can deeply affect a dog. Moving to a new house, changing the owner's work schedule, bringing a new pet into the home, loud sounds, visitors, or even rearranging furniture can disturb a dog's mental balance. Stress affects the nervous system, and the nervous system controls digestion. When a dog feels stressed, the stomach becomes sensitive, digestion slows down, and appetite decreases. This is why a stressed dog often smells food, but does not eat it. The body is not ready to digest, so the brain sends a signal to stop eating. Another important cause is pain inside the mouth. This is a problem many owners completely miss. Dogs are very good at hiding pain. In the wild, showing pain is a weakness, so dogs naturally hide it. A dog with tooth pain, gum infection, or a broken tooth may still act normal but will avoid chewing food. Hard food becomes painful. Even soft food can hurt if the gums are inflamed. The dog may approach the bowl, feel hungry, but after trying to chew, the pain forces the dog to stop. Over time, the dog learns that eating causes pain, so it starts avoiding food completely. This problem becomes worse if not treated, because mouth infections can spread to other parts of the body. Sudden changes in dog food are another very common cause of appetite loss. Many owners change food quickly without understanding how sensitive a dog's digestive system is. A dog's stomach needs time to adjust to new ingredients. When food is changed suddenly, the stomach may react with nausea, gas, discomfort, or pain. Even if the new food is high quality, the dog may still feel sick after eating it. Dogs remember negative experiences very strongly. If a dog eats a new food and feels uncomfortable afterward, the dog may refuse that food again, even if the stomach problem has already passed. This creates a cycle where the dog smells the food, remembers discomfort, and chooses not to eat. Stomach problems are another serious reason dogs stop eating. Dogs explore the world with their mouths. They may eat garbage, spoiled food, plastic, toxic plants, or small objects. They may also get infections or worms. All these problems cause stomach pain, nausea, or internal discomfort. When a dog's stomach hurts, eating feels dangerous to the body. The natural response is to stop eating. This is the dog's way of protecting itself. Many dogs with stomach issues will also lick their lips repeatedly, swallow air, or appear restless. These signs are often ignored, but they are important signals that something is wrong inside. Internal illness is one of the most serious causes of appetite loss. Fever, infection, inflammation, or pain in any part of the body can reduce appetite. The body uses a lot of energy to fight illness, and digestion becomes less important. This is why loss of appetite is often the first sign of disease. A dog may look normal on the outside, but inside the body, a problem may already be developing. Waiting too long in such cases can make treatment more difficult later. Now, let us talk about solutions. The first and most important step is observation. Instead of focusing only on the food bowl, observe your dog's full behavior. Notice energy levels, movement, interest in surroundings, and water intake. If your dog is drinking water normally but eating less, it may be a mild or early issue. If your dog refuses both food and water, the problem is more serious and needs quick attention. Reducing stress is one of the most effective solutions. Dogs need routine and predictability. Feeding at the same time, walking at the same time, and sleeping in the same place helps the dog feel safe. Creating a calm environment during feeding time is also important. Loud noises, children running, or other pets disturbing the dog can increase anxiety and reduce appetite. A calm, quiet feeding space helps the dog relax and eat better. Checking the mouth is another important step. Owners should gently look at the dog's gums and teeth. Redness, swelling, bad smell, or visible damage are warning signs. Mouth problems cannot be solved at home and require a vet visit. Early treatment prevents pain and serious infections. Food changes should always be done slowly. Mixing old and new food over several days allows the stomach to adjust. This simple step prevents many digestion problems and helps maintain appetite. Owners should also avoid giving too many treats, because treats can reduce hunger for regular meals and confuse eating habits. Knowing when to visit a vet is critical. If a dog does not eat for 2 days, or a puppy does not eat for 1 day, professional help is needed. If appetite loss is combined with vomiting, diarrhea, weakness, shaking, or unusual behavior, waiting can be dangerous. Early treatment always gives better results. When a dog does not eat properly for some time, energy levels drop. The body feels weak. Muscles feel tired. The brain receives fewer nutrients. This leads to changes in mood and behavior. The dog becomes less active, less playful, and more silent. This is where the next problem begins. Owners often say, "My dog is suddenly very quiet." They do not realize that silence is often the result of ongoing physical or emotional discomfort. This is why understanding eating problems is the foundation of dog health. Food is energy, and energy controls behavior. When eating changes, behavior always follows. In the next part, we will continue this same script and explain why dogs become suddenly quiet, how it connects to appetite loss, and what owners should do at the right time.